Let's go on with agenda item 5J, progress reports. This year, we have a large amount of progress reports. I propose we take these reports forward through separate discussions. First, on the reports linked to communicable diseases. The relevant document can be found in EUR/RC69/8A on HIV and EUR/RC69/8B on hepatitis. Second, we continue with corporate services and enabling functions, reviewing document EUR/RC69/8C. Lastly, we move to cross-cutting issues, reviewing documents EUR/RC69/8D on the Action Plan for Sexual and Reproductive Health and EUR/RC69/8E on the roadmap to implement the 2030 Agenda for Sustainable Development. If this is agreeable to you, we will start with the first debate on the reports related to implementation of the Action Plan of the Health Sector Response to HIV and implementation of the Action Plan for the Health Sector Response to Viral Hepatitis. The reports are in EUR/RC69/8A and B. Dr. Masoud Dara, Acting Director, Communicable Diseases, has a brief presentation for us.
Thank you, Mr. President. Distinguished Ministers of Health, Their Excellencies, it's a pleasure to present today a very short presentation on HIV and hepatitis. As you know, in 2016, two action plans, you endorsed two action plans, one on HIV, one on hepatitis. The two action plans was endorsed and they were in line with the global strategy, health sector strategy to address HIV and hepatitis. Now, we have two progress reports reviewing the status of response in our region to HIV and hepatitis. There are some progress, as you already noticed. Very important, as you know, on HIV. The first thing you want to do to make sure that there are less people getting HIV infected. And for that, obviously, you want to make sure that prevention is in place. And prevention, of course, also means that health education is in place, links to the health literacy that was discussed, but also very cost-effective interventions, including needle exchange programs, as well as also addressing the need of the key population. If you look at the progress, we see that we have 82% of the people who are estimated to be infected with HIV know their status. You know the target is 90%. So that's already a progress, but we are very concerned with the late diagnosis. More than half of people are detected at the late stage where the immune system is very low. And also this is an indication that is also ongoing HIV transmission is happening. If you look at the second 90%, means that how many percentage of those who know their status are put on treatment. The latest progress that we have is 66%. You know that WHO recommends treating all, and the target for 2020 is 90%. So our region is delayed with the implementation of access for treatment for all. And the last 90, which is extremely also important, is that how many percentage of those who are put on treatment are virally suppressed. And that's a very good indication because they will not be transmitting HIV further and can lead healthy lives. And our region is as 84%. Now, very important for the reporters to note that the progress report that we have put in and submitted to you is indicating all the numbers correctly. But on paragraph 12, we have given different numbers because that numbers refer to the estimated people living with HIV. So this one is the estimated people living with HIV, how many percentage of them are knowing their status, how many of them are put on treatment, how many of them have viral suppressed. So depending on denominators, you will have different percentage, and the percentage is 54% of the estimated people with HIV are put on treatment, and 42% of estimated people with HIV are viral suppressed. So that basically is very important to clarify. As you know, our region is affected by HIV with more than 2.3 million people estimated to be living with HIV. So under the regional director's leadership, as well as in close collaboration with the UNAIDS and the government of Netherlands, there was a meeting back-to-back with the Global AIDS Conference in Amsterdam, where the ministers of health were invited to have a policy dialogue in terms of what needs to be done further to address the HIV issue in our region. And the result of that was to develop a roadmap for each of the countries, which was requested by a regional director, and we developed with the support of your national experts, as well as the UNAIDS and other partners, 14 roadmaps. And these roadmaps were endorsed by the ministers of health. So we said, what are the low-hanging fruit? What are the needs, the things that need to be done till 2020? And we also worked on compendium of good practices, because it's not enough to mention what needs to be done, but also how it needs to be done. And there are very good practices within your countries that can be used. So we launched this compendium of good practices, which are 52 good examples from the 33 member states. And also we worked on the essential package of HIV services for migrants. And that's very important. In Central Asia, we started this one with the ministers of health of in Central Asia, under the leadership of Kazakhstan and other countries, how the services need to be arranged for the migrants. Very important in hepatitis is ongoing collection of good practices, because that's also very important to be done. So far, we have 20 examples from 13 countries. There still is some time for the next 2-3 weeks to collect more examples. Now we are also moving to more online repository of good practices, because that we have already understood member states feel very useful that they can have access to the examples from other countries and also see their own examples in their country. A few words about the areas that we are supporting. We have established a treatment reference group. The HIV treatment reference group was established. It is very important to optimize treatment regimen. As the ministers of health, we have a challenge if we have 40, 50 different treatment regimen, as opposed to optimized treatment regimen, which is the most effective one, and for being able to procure timely and increase the access, as I mentioned earlier, to reach the second 90%. We also expanded the mandate of the European Laboratory Initiative, which was working only on tuberculosis, but including HIV and hepatitis, to have integrated testing at various levels, particularly bringing self-testing, which is very important, community-based testing, but also having good tools for the quality assured testing. The other area we are quite proud of is under the leadership of regional director, we have established this year a regional validation committee that looking at the countries, how they are validating the elimination of mother-to-child transmission. And of course, there is some progress on that one in terms of the countries have already achieved that one. We encourage other countries also to follow suit, and the committee is also happy to support more countries to do that one, because it should not be any child getting HIV or syphilis through vertical transmission in our region. Last but not least, very important, the collaboration with NGOs and partners, academics, and we have established a regional collaborating committee on tuberculosis, which also expanded to HIV and viral hepatitis. And this has been, of course, a great pleasure to work with the other partners. National plans have been expanded. Before the hepatitis action plan, there were 13 countries having their national hepatitis action plan. Now there are 33, and we are supporting the countries under the leadership of Georgia, because they have been also one of our pioneer countries in terms of hepatitis. We organized a first regional consultation where we look at the country examples. There were 45 member states with 120 participants. They exchanged on how they are doing with the hepatitis, and the idea is to also improve the monitoring framework for hepatitis. The last, very important, where we are going from here, we need to really prioritize the preventive measures for the key population. There are evidence in terms of how to address the needs of the key population in our region. They're also important to have the pre-exposure prophylactic treatment for MSMs and other groups that they need it, because that's what we need to further work on that one. Very important to decentralize and also simplify the HIV testing and hepatitis, bring it closer to where people are there, the key populations are there. And also last but not least, in making sure the treatment regimen are optimized and scaling up the early treatment and full care, which is helping people having healthy lives. All of them, of course, under the universal health coverage, and also needs the national funding. And there have been, of course, increase in the funding by the member state, but there's still more resources needed, and through the people-centered care and also innovative approach that needs to be in place. Thank you very much for your attention.
Thank you very much, Dr. Dara. I will now immediately open the floor. Delegates wishing to take the floor, please raise up your nameplates. Netherlands, please, followed by Poland.
Thank you, Executive President. HIV persists as a major public health threat in the WHO European region, and therefore still requires our utmost attention. The Netherlands' tolerant attitude and robust and consistent HIV response has become known as the Dutch approach. We provide sexuality education starting from a young age. We have harm reduction and sex worker-friendly healthcare services. We have needle exchange, and we have a life insurance for people living with HIV. Last year, our National Institute for Public Health, together with civil society, treatment providers and affected populations, drafted a new national action plan on HIV and STI with ambitious targets. Actions cannot be successful without participation and commitment of all relevant stakeholders. Recently, we started with reimbursement of pre-exposure prophylaxis for a high-risk group of MSM. We expect that this can substantially reduce the new numbers of HIV infections. Although we have reached the 90-90-90 objective in our country, we have to remain vigilant and active. In July 2018, our country hosted the International AIDS Conference. Back-to-back with this conference, the Netherlands organized a ministerial policy dialogue on HIV in Eastern Europe and Central Asia, together with WHO and UNAIDS, to build stronger bridges among the ECCA countries, where the epidemic continues to rise. Countries expect strong political determination to invest and strengthen the HIV response, including stronger engagement with civil society, to ultimately make 90-90-90 a reality. Let us recall our commitment to roll out evidence-based country action plans with the whole of government and the whole of society approach, prioritizing the needs of all key populations, removing legal barriers, and providing accessible services and fully financed responses. I would like to encourage all of us to continue what we started in Amsterdam and join efforts to turn the tide. Thank you.
Thank you, Netherlands. Poland, please, followed by Russian Federation.
Thank you, Mr. President. With regard to the implementation of the action plan on HIV response, let me stress that Poland was among the first countries in the Central and Eastern Europe to offer a wide and free access to diagnostics, antiretroviral treatment and care for people living with HIV/AIDS. The elements of our systems are national policy, national program for preventing HIV infections and combating AIDS, sustainable financing of antiretroviral treatment that is available in 22 Polish hospitals, being the reference centers, plus the network of 30 voluntary counseling and testing centers, as well as a very good collaboration with non-governmental and civil society organizations. It allows broad and equal access to comprehensive services for prevention, testing, treatment, and care for all in need in Poland. The current system of anonymous and free HIV testing in Poland contributes to minimizing the problem of stigma and discrimination of infected people. Since the very beginning, Poland developed a sustainable financing of the antiretroviral treatment. In 2018, the state allocation summed up to 60 million euro. The prophylaxis of mother-to-child transmission is one of the key elements of national strategy on HIV/AIDS. All HIV-positive pregnant women whose serological status is known are covered by the prophylaxis of vertical transmission. Considering the high percentage of people living with HIV in Europe and co-infected with HCV, TB, and other sexually transmitted infections, Poland supports the development of integrated testing strategies and programs for HIV and other STIs. The access to comprehensive services for HIV situates Poland among countries of a very low HIV prevalence, with approximately 1,000 new infections detected each year. At the same time, we are aware that increasing trend in the number of new HIV in Europe and alarming rates of the late HIV diagnosis. Let me recall the active role of the National AIDS Center in Poland in the development and adaptation process of the UNAIDS strategy for 2016-2021. Polish best practices may still serve as a benchmark for countries of the eastern part of our region. Finally, to recall Poland's solid position in Europe in terms of HIV prevention and control, I would like to mention that Poland is hosting the second European PrEP and HIV Summit that is being organized in Warsaw between 10 and 12 October this year. Thank you.
Thank you, Poland. Russian Federation, please, followed by Germany.
Спасибо, господин председатель. Российская Федерация благодарит секретариат ВОЗ за представленный отчет и поддерживает усилия регионального бюро ВОЗ по борьбе с ВИЧ. Профилактика, раннее выявление ВИЧ-инфекции, своевременное лечение и наблюдение больных с ВИЧ-инфекцией является одним из национальных приоритетов России. Существенную роль в реализации необходимых мер по данным направлениям играет взаимное сотрудничество России с UNAIDS и ВОЗ. В России реализуется государственная стратегия противодействия распространению ВИЧ-инфекции на период до 2020 года, которая базируется на комплексном подходе и решает одновременно правовые, финансовые, организационные и технические вопросы в целях реализации поставленных задач. Нам удалось стабилизировать эпидемический процесс у взрослых. Количество новых случаев инфекции не прирастает, как в предыдущие годы, а с 2016 года сохраняется на уровне около 86 тысяч по данным форм федерального статистического наблюдения. Почти полностью прерван вертикальный путь передачи инфекции. И на сегодняшний день, по итогам 2018 года, риск передачи ВИЧ от матери к ребенку составляет 1,7%. Благодаря расширению охвата населения тестированием на ВИЧ-инфекцию и повышению клинической настороженности медицинских специалистов в отношении ВИЧ-инфекции удалось увеличить раннюю диагностику ВИЧ-инфекции у взрослого населения до 70% и у детей до 83%. В 2019 году в России принята ведомственная целевая программа по профилактике и борьбе с социально значимыми заболеваниями, которая ставит целью в том числе увеличение доли лиц, зараженных ВИЧ, получающих антиретровирусную терапию. Спасибо.
Thank you very much. Germany, please.
Vielen Dank, Herr Vorsitzender. Wir begrüßen die Fortschritte, die die europäische Region bei der Bekämpfung von HIV und Hepatitis erzielt hat. Nach wie vor stellen HIV und Hepatitis eine große Herausforderung für die öffentliche Gesundheit in unserer Region dar. In Deutschland haben wir seit 3 Jahren einen integrierten Ansatz zur Eindämmung von HIV, Hepatitis B und C sowie anderer sexuell übertragbarer Infektionen. In der Folge haben sich die Kooperationen zwischen den ärztlichen Fachgesellschaften sowie den Präventionsangeboten der Nichtregierungsorganisationen erheblich verbessert. Um bei der Eindämmung von HIV und Hepatitis weiter voranzukommen, ist aus unserer Sicht eine weitere Stärkung von Präventionsangeboten notwendig. Die internationalen Erfahrungen belegen, dass es wesentlich günstiger ist, HIV-Infektionen durch zielgerichtete und effektive Präventionskonzepte zu verhindern, als danach in lebenslange Therapien zu investieren. Wir beobachten deshalb mit Sorge, dass nach Angaben des ECDC die Präventionsausgaben in vielen europäischen Ländern zurückgehen. Zugleich könnte durch eine frühzeitige Diagnostik und eine zeitnahe Therapie weitere Fortschritte erzielt werden. Auch in Deutschland liegt der Anteil der zu spät entdeckten HIV-Diagnosen bei 30%. Dies ist zu hoch. Wir haben deshalb den HIV-Selbsttest zum Verkauf in Apotheken freigegeben und niedrigschwellige Testprojekte für Menschen, die Drogen gebrauchen, und Männer, die Sex mit Männern haben, ausgebaut. Hierfür fördern wir gezielt auch Angebote von Nichtregierungsorganisationen. Wichtig sind Angebotsstrukturen, in denen sich Menschen aufgehoben und nicht diskriminiert fühlen. In Deutschland sind die HIV-Neuinfektionszahlen seit wenigen Jahren rückläufig. Wir hoffen, die Zahlen durch die PrEP noch weiter zu senken. Seit Anfang dieses Monats werden die Medikamente und die notwendigen Begleituntersuchungen durch die Krankenkassen übernommen. Bei der Eindämmung von Hepatitis C sind wir noch nicht so weit wie erhofft. Um die Gruppe der injizierenden Drogengebraucher besser erreichen zu können, haben wir zum Beispiel eine Informationskampagne für die Ärzteschaft gestartet. Darüber hinaus stellt die Impfung einen wesentlichen Ansatzpunkt zur Eliminierung der Hepatitis B dar. Insgesamt streben wir eine Steigerung der Impfquoten bei Säuglingen, Kindern und Jugendlichen sowie bei Menschen mit erhöhtem Hepatitis B-Risiko an, wie Männer, die Sex mit Männern haben, und Menschen mit injizierendem Drogengebrauch. Ein Schlüssel zu dem gemeinsamen Ziel, AIDS zu beenden und Hepatitis zu eliminieren, ist der weitere Abbau von Stigma und Diskriminierung. Wir müssen uns in der europäischen Region weiterhin verstärkt dafür einsetzen, dass Menschen schnellen Zugang zu Diagnose, Impfungen und Behandlung erhalten und nicht weiter ausgegrenzt werden. Vielen Dank.
Thank you. As I see no other delegate asking for the floor, I give the floor now to the United Nations Development Programme.
Thank you, Chair, distinguished delegates and all protocols observed. So UNDP would like to thank WHO for the invitation and the opportunity to speak at this important regional committee meeting. We are at a critical time to work jointly to achieve sustainable development goals and contribute to improving health outcomes in the European region. In support of implementing the SDGs, UNDP's strategic plan includes two platforms: a multi-sectoral country support platform for SDGs with Global Development Advisory and an implementation support platform. The strategic plan identifies 6 signature solutions along which UNDP aligns its resources and expertise, seeking to increase its impact on poverty eradication, governance, energy access, gender equality, resilience, environmental sustainability. But more importantly, it's built on principles of universality, equality, and leaving no one behind. Meanwhile, we have a Connecting the Dots health and development strategy that has 3 areas of action, and they include reducing inequalities and social exclusion, promoting effective and inclusive governance for health, and building resilience and sustainable health systems. So UNDP is also one of the 12 health organizations that developed jointly with WHO and is implementing a global action plan for healthy lives and well-being. So key priorities in Eastern Europe, we are working on legal environment assessments for HIV, TB, and hepatitis. We have finalized legal environments in a number of countries and ongoing in Ukraine, Armenia, Belarus, and Moldova. So member states increasingly are taking up the key recommendations to improve rights situations of people living with HIV and key populations to access essential HIV and TB services. We are also improving legal awareness among duty bearers. We are meeting with judges in the region for the very first time in Moldova in Chisinau this month, and we'll bring together judges from 7 countries of EECA region. We're promoting access to justice and legal protection of people living with HIV and monitoring rights violations. We're also seeking to improve sustainability of financing HIV and health responses in the context of UHC. We also implement HIV and TB grants in a number of countries as principal recipients, currently in Kyrgyzstan, Tajikistan, and Turkmenistan. We would like to continue to encourage health procurement, which UNDP undertakes, to integrate other policy support, which includes enhancing health governance in the areas of transparency, addressing corruption or ethical procurement, and using intellectual property and TRIPS flexibilities to ensure increased access to essential medicines and introduce innovative e-stock management systems. I thank you.
Thank you. And now, please, International Organization for Migration.
Thank you, Mr. Chair. As the UN Migration Agency, the International Organization for Migration would like to thank the WHO Regional Committee for the opportunity to make a statement about the progress report of the Action Plan for the Health Sector Response to HIV in the WHO European region. Within its Migration Health Division, IOM delivers and promotes comprehensive, preventive, and curative health programs which are beneficial, accessible, and equitable for migrants and mobile populations. IOM welcomes the WHO efforts to combat HIV by implementing the Action Plan for the Health Sector Response to HIV in the region. Last year, IOM, along with the other agencies involved, actively contributed to the UN Common Position Paper on ending TB, HIV, and viral hepatitis through intersectoral collaboration. The paper conveys the common values uniting the UN, that is, equity, leaving no one behind, particularly marginalized populations and people who are vulnerable. I would like to emphasize that HIV disproportionately affects those in vulnerable situations, including migrants, refugees, and internally displaced persons, deeming them a key affected population. In this regard, public health approaches must be inclusive of these populations. Considering the situation in the region of Southeastern Europe, Eastern Europe, and Central Asia, currently 1 in 8 persons in the region is a migrant, and more than half of these migrants are women. Migration within the region will increase as it is supported by the Eurasian Economic Union and bilateral agreements between states. At the same time, HIV infection rates are on the rise in the region. The Russian Federation, main country of destination for migrant workers from Eastern Europe and Central Asia, as well as Ukraine, with 1.5 million people who have been internally displaced by the conflict, face HIV epidemics. Multiple factors contribute to migrants' vulnerabilities regarding risk behavior and contracting HIV and other sexually transmitted diseases. Studies conducted by IOM in the South Caucasus countries of Armenia, Azerbaijan, and Georgia, as well as in Belarus, show that migrants are insufficiently aware about HIV risk and lack of knowledge on testing possibilities when abroad. Additionally, travel restrictions and deportations from several countries in the region for people living with HIV limit the access to care or prevent migrants in accessing services. IOM therefore highly supports any effort that the essential package of HIV services is equitable and accessible for all, with priority given to key populations, among them migrants moving within and between Central Asian and Eastern European countries. Thank you.
Thank you very much. And now, UNH, please.
Thank you. And thank you, Mr. Chair, for this opportunity on behalf of UNH to commend the excellent work of WHO on HIV and comorbidities across the European region. The progress report that was presented to us contains many practical examples of what WHO has achieved in this period across the 5 strategic directions. So I'd like to take this opportunity to thank again Susanne Jakob for having consistently drawn the attention of this regional committee to the persistent challenges posed to the region by the HIV, TB, and hepatitis epidemics. Also, special thanks to Dr. Masoud Dara and the joint UN team implementing the common position for ending HIV, TB, and hepatitis for their remarkable work. I also wish to take this opportunity to highlight concerning developments that are specific to the member states in our region. As already said by previous speakers, HIV is not decreasing. Incidence of HIV is not decreasing in our region. The number of new HIV infections reported each year in the region has not decreased over the last 8 years. It actually keeps increasing in most countries in the eastern part of the region and Central Asia. We increasingly see 3 groups of member states in the region. Those few that are on track to achieve their commitments on HIV to end AIDS, many that are standing still, and too many member states who are still facing a growing epidemic because the key components of an effective HIV response are still lacking. Let's use as a lens our progress towards the 90-90-90 targets that every member state agreed to achieve by the end of 2020. Regarding the first 90, that is the percentage of people with HIV who know their status, only 10 member states in the region, or 19%, have achieved the target. Regarding the second 90, the percentage of people with HIV who are diagnosed and on treatment, only 12 member states, or 22%, have achieved the target. The third 90, the percentage of people with HIV who are on treatment and virally suppressed, is the critical one, because it measures how successful treatment ultimately is and determines how much preventative effect of treatment one can expect on HIV transmission at population level. Only 15 member states, or 28%, have achieved this target, as reported to UNAIDS. Austria, Croatia, Denmark, Estonia, Iceland, Ireland, UK, Luxembourg, Montenegro, Netherlands, North Macedonia, Romania, Spain, Sweden, and Switzerland. At the end of 2018, only 3 member states in Euro achieved all 3 90s. And as I said earlier, most countries are not on track to reach the target of a 75% reduction of new infections by 2020. So we at UNAIDS would like this to be a stark wake-up call. While more member states in other regions with fewer resources and a larger HIV burden are on track to end AIDS, the European region is not. On hepatitis, the report rightly points out to undeniable progress, and the regional office here has continuously promoted a public health approach to viral hepatitis, including simplified diagnostic and treatment algorithms, introduction of pangenotypic regimens, and the expansion of chronic hepatitis care, and treatment coverage based on universal coverage principles. It has emphasized simplification and integration is key for our region, where vulnerable groups to HIV, TB, and hepatitis so often overlap. However, hepatitis treatment still is only at an early stage in most countries of the region, despite the availability of effective and now affordable medicines. So clearly, there's still significant work to be done. So, honorable delegates, as I conclude, let me return to the issue of HIV/AIDS in our region. There is still time to correct our course before the end of 2020. So let us recommit to get all member states' programs back on the fast track to ending AIDS. Thank you.
Thank you. And now I give the floor to the Northern Dimension Partnership in Public Health and Social Wellbeing.
Thank you, Chair, for the opportunity to speak on behalf of the Northern Dimension Partnership. When the NDPHS was established in 2003, HIV infection was decided as one of the key priorities of the partnership's activity, and the expert group on HIV/AIDS was established. With time, it became obvious that HIV often walks hand in hand with another deadly infection, tuberculosis. Eventually, the scope of the expert group was broadened to encompass tuberculosis as well. A few years ago, the name of the expert group was changed again to include associated infections, where hepatitis is usually implied as an associated condition. The partnership has elevated the visibility of hepatitis on the agenda of infections addressed to the Northern Dimension area. Thus, changes in the name of the expert group reflect the transformations in the epidemiological picture and political agenda in the past 15 years. The current epidemiological situation for HIV infection, tuberculosis, and hepatitis across the Northern Dimension area is diverse. There are countries which have consistently low figures for the infections, but in the Northern Dimension overall, the progress is not fast or steady enough to achieve success in Objective 3 of the Sustainable Development Goals. There are also challenges and development needs that are common for the whole region. An example of such a challenge is the need to focus on developing well-linked, integrated, and people-centered service delivery, and particularly for the vulnerable groups of people, as already mentioned by many other speakers before. Being a solid network represented by experts from countries which are characterized by various epidemiological hallmarks, employ various approaches and interventions in response to epidemic processes, the NDPHS expert group provides a platform for sharing best practices and novel techniques in prevention, diagnosis, treatment, and care. We are often having very open and honest exchange of information among the peers from our partner countries, and this is valued as a crucial prerequisite for crafting policies, clinical practices, and research. With this, I would like to conclude. The NDPHS highly appreciates the lead role of WHO plays in combating HIV infection and hepatitis, and the efforts of the member states invest into response. And we are sure that our partnership will continue its collaborative actions, contributing to implementing the WHO strategies until we see the elimination of those threats for people's health and lives. Thank you for your attention.
Thank you. And now, AIDS Healthcare Foundation, please.
Yes. Honorable Chair, distinguished delegates, I'm making a statement on behalf of AIDS Healthcare Foundation Europe, supported by World Federation of Occupational Therapists, European Organization for All Occupational Therapists through their national associations, and World Organization of Family Doctors. The countries in the WHO European region are midway in implementing the second action plan for the health sector response to HIV. The member states jointly agreed and committed to ending the HIV epidemic by implementing effective prevention interventions, testing strategies, and ensuring access to quality treatment and care to everybody. General population, people who use drugs, men who have sex with men, sex workers, migrants, prisoners, youth, children, women and men. And as we saw during this meeting, the perception is that we are successful in addressing the HIV epidemic in Europe. But in fact, the WHO European region has uncontrolled growing HIV epidemic. HIV as a communicable disease is not a problem of a separate country. It's our joint, unresolved European problem. We applaud unquestionable achievements on the way to solve it. Notable increase in state allocation in Eastern Europe and Central Asia countries to fund the HIV response, development of the country roadmaps, work on strengthening national HIV strategic information system, revision of HIV testing policies to allow faster confirmation of HIV diagnosis, work towards HIV treatment optimization, and development of essential care package for HIV among people moving within and between the Central Asian countries. All this work happened with the support and guidance of WHO Europe Secretariat and our other European institutions. But much more needs to be done. No deaths related to HIV are acceptable anymore. We have successful HIV treatment, which needs to be available to everybody. And gaps between HIV and TB services need to be closed through integration. One case of new HIV infection is one too many. We need a package of successful prevention interventions available, and treatment as prevention to be utilized to its highest potential. There is an urgent need to return and re-engage those who have dropped out of HIV care. The region needs to invest in developing best practices for successful linkage, adherence, and retention. People-centered care for everybody. Healthcare that listens to clients' needs, it's what we need. And as the European region faces the biggest shifts of populations since the Second World War, we need to think collectively how to ensure proper care for everybody, including migrant populations. We do believe that the story of HIV in Europe can be a story of success. We have all the tools, they work if they are implemented. We urge all the member states to commit to act upon them. We dream that the year 2030 is the year that we can collectively say that we as Europe have made it. We ask for your joint political leadership that the story of HIV in Europe can be a story of success. Thank you.
Thank you very much. And now I please ask Dr. Dara if he wants to give short response to some of the comments and questions. Masoud, please.
Thank you very much, Mr. President. Very much impressed by overwhelming inputs from the member states and key partners. Very important that we need to do more and do the things differently, particularly in line with achieving the triple billions. So universal health coverage and also triple billions, basically connecting all the dots. So not only the disease-specific vertical approach, but also health system approach addressing the social determinants. I will also thank all the partners, NGOs, your colleagues at the country level, because they are doing their best, your ministers, because they're also committed and increasing their resources and use the resources very efficiently, more efficient in the future. I would like also to thank also our colleagues from ECDC, where we have very close collaboration in terms of data collection and support to the member states, particularly in the area of HIV and hepatitis. And we are in this together. We will be working together. So you would see more support coming from our side. I would like to also acknowledge my colleagues, Dr. Nicole Segi, who is basically our HIV, hepatitis, and STI unit lead. I would like to ask her to stand up. And of course, Elena Wolf and also Anton Mozolewski and all our team members, we are there to support you. Thank you very much for your attention.